नमस्ते, मैं हर्षल देसाई आप सभी को आमंत्रित करता हूं एक काफी महत्वपूर्ण कार्यक्रम जो ई हेल्थ मैगजीन ने वियाट्रिस ऑर्गेनाइजेशन के सपोर्ट से कंसेप्चुअलाइज किया है और इस कार्यक्रम का नाम है पनासिया। पनासिया एक 6 महीने का एक ऐसा कार्यक्रम है जिसमें हम पूरे भारत देश से अलग अलग एक्सपर्ट्स जो कि योगा, न्यूट्रिशन, मेंटल हेल्थ, न्यूरोलॉजी, इसके अलावा एंडोक्राइनोलॉजी, इसके अलावा और दूसरे जितने मेडिकल फील्ड्स हैं वहां से अलग अलग एक्सपर्ट्स को लेकर हम 6 महीने के लिए हर रविवार को ऑनलाइन सेशन कंडक्ट करेंगे। ये कार्यक्रम इसलिए महत्वपूर्ण है क्योंकि हम सभी जानते हैं महामारी के समय में हम सभी लोग काफी एक डर के माहौल में रह रहे हैं। हम हमेशा ये प्रयत्न कर रहे हैं कि किस तरह से हमारे रोग प्रतिरोधक क्षमता हमारे शरीर की बढ़ाई जाए ताकि इस महामारी से हम बचे रहें। इन्हीं सब चीजों को ध्यान में रखते हुए हम लोगों ने इस कार्यक्रम की संकल्पना की है और इस कार्यक्रम में पार्टिसिपेट करने पर निश्चित रूप से सभी लोगों को बहुत फायदा पहुंचने वाला है। 3 चीजें हैं महत्वपूर्ण जो मैं आप सभी को बताना चाहता हूं। पहली चीज, ये कार्यक्रम ऑनलाइन हो रहा है जिसकी वजह से आपको अपने घरों से बाहर निकलने की जरूरत नहीं है। आप अपने घरों में बैठकर इस कार्यक्रम का लाभ उठा सकते हैं। दूसरी चीज, जो एक्सपर्ट्स, जो विशेषज्ञ हमारे इस कार्यक्रम में आने वाले हैं वो सभी काफी जाने माने और काफी फेमस प्रैक्टिशनर्स हैं, एक्सपर्ट्स हैं, रिनाउंड पर्सनालिटीज हैं जो योगा, न्यूट्रिशन, मेंटल हेल्थ, एंडोक्राइनोलॉजी, कार्डियोलॉजी, न्यूरोलॉजी, इन सभी चीजों के ऊपर लगभग 30 मिनट से लेकर 60 मिनट के इस सेशन में आपके साथ वार्तालाप करेंगे। और तीसरी चीज ये है कि इसके लिए आपको किसी भी धनराशि को देने की आवश्यकता नहीं है। ये कार्यक्रम एकदम फ्री है। आपके लिए ये कार्यक्रम एकदम फ्री है। सो मैं आप सभी को आमंत्रित करता हूँ, आप panacea.eletsonline.com इस वेबसाइट को विजिट करें। विजिट करने पर वहां पे आप रजिस्टर करें और रजिस्टर करके आप इन सारे सेशंस का जो कि 6 महीने तक चलने वाले हैं उनका लाभ उठाएं। Thank you so much, both the experts, Sohini Roy Chaudhary Das Gupta and Dr. Sudipta Roy, for conducting these 2 sessions on yoga and mental health and psychiatry. Thank you so much. Once again, we would like to inform all the audience that Panacea is a 6-month campaign, and every Sunday we are bringing experts to you from different corners of the country. Experts who are master of their subjects, and they are conducting this session online. And as I mentioned, Dr. Praveen Sadarmin has joined us now. Good morning, Doctor.
Good morning. Good morning.
Thank you so much, Doctor, for joining us. So I'll just take 1 minute to update you what happened today morning. So we had 2 sessions by yoga expert and expert on mental health, Sohini Roy Chaudhary Das Gupta and Dr. Sudipta Roy. They came live and they conducted the 2 sessions on yoga and mental health. Now this is the 3rd session by you, Dr. Praveen. We thank you so much and we thank Narayana Health for supporting our initiative and accepting our request to take out time from your busy schedule to conduct this session online. So Dr. Praveen Sadarmin, for the next 45 minutes, this virtual stage will be yours, and in the end we will ask some questions from the comments. People will be leaving some comments on our Facebook pages and other social media pages. So if you have any question, we will come back to you again. And with this, Dr. Praveen Sadarmin, I would like to leave this virtual stage to you, sir, for the next 45 minutes.
Thank you very much. Am I audible?
Audible, sir. You are audible, sir.
Hello, am I audible?
Yes, sir, you are audible.
Thank you. Once again, I thank this opportunity for me to be with you guys and share my thoughts on this very important subject. As we know, we are going through an unprecedented pandemic. I'll try to keep this session as general as possible. I'll try to make it non-medical. Okay. While my slides are loading up, as I said, I'll try to stick to about 30 to 40 minutes of presentation and maybe about 5 to 10 minutes of questions at the end. Please feel free to ask me any questions. I'll try to answer them to the best of my ability. Okay.
Sure thing, doctor. If you need any help, please let us know in running the PPT. Meanwhile, I'll take a minute to introduce Dr. Praveen Sadarmin. He is a consultant interventional cardiologist at Narayana Institute of Cardiac Sciences, Narayana Hrudayalaya, Bangalore, India. And his area of interest are coronary intervention, angiography and angioplasty, complex PCI angioplasty, pacing and cardiography in addition to clinical cardiology. He is an international cardiologist trained in the United Kingdom with a passion for high quality patient care and holistic approach. So we are very glad to have such an expert with us in this session. Over to you, Dr. Praveen Sadarmin.
Thank you. Is my screen visible or my slides visible?
Yes, sir. Yes, sir. We can see your screen. We can see the PPT. Heart care in COVID times.
Thank you very much. Okay, without much ado, I'm going to start, and I just want to put this slide just to make sure people understand I'm not an infectious disease specialist or a COVID specialist. I'm a cardiologist. I deal with the heart effects that we see from COVID and in general. Okay. I think people have seen this picture 1,000 times. We've been through this for the last 8 to 10 months, and wherever you go, advertisements on the social media, this is a very, very common picture. Even small kids understand the picture these days. Just to start off with some statistics, this is from the Johns Hopkins University in America. They have been tracking the COVID infection from day one. Up to date, we've had about 7 crore 16 lakh cases, and unfortunately 16 lakh deaths as well, and a good number of patients have recovered as well. And this slide is quite important. I've just put this slide to show some perspective of where we are in India compared to the rest of the world. To begin with, I'll say we are the third highest number of cases in the world, just because of the size of our population. It is led by United States of America, followed by Brazil, and then India. But I've highlighted here in the red box here, where this is the deaths per million population. So as you can see, the number for India is 103. So that is quite a small number compared to America, where it is 912. So for Brazil is 846, for France 881, Italy more than 1,000, Spain more than 1,000. There is some criticism that our data is not as robust as the data from the Western world. However, taking that into account, we still are a significantly lower margin compared to the rest of the world. So we are truly lucky to be in this position. Just imagine if, with all those facilities in the Western world, they are struggling with such a huge number of cases and number of deaths. If we had the same situation in India, about 10 times the number of deaths, and the hospitals would, it's already overwhelmed now. They're not able to treat patients, especially at the peak of the situation. Imagine how worse it could have been. So we are truly better off compared to most of these nations. So this is the latest data from India, where there are about 98 lakhs 26,775 cases, and the actual data for yesterday was about 30,000 cases, and a good number of recoveries there. They have suggested the recovery rate in India is about 94%. So 92 to 94% is what they have quoted. That is a significant number, and although for individuals who've been affected, it doesn't give much comfort. On a population basis, this is excellent numbers. So what are our first thoughts when they said we got a pandemic, we got COVID? The first thing the world experienced was a lockdown. It was never seen before. The last pandemic was in 1919. That was a Spanish pandemic. So the whole world went into lockdown. Along with it, India also had some very strict conditions, and a lot of freedom was taken away from us. So we were not able to socialize, we were not able to go out, we were not able to meet friends. Our daily life was totally turned upside down. So that had a significant impact on the minds of the people. So there was widespread fear. Why there was fear? Because it was a new entity. No one knew what to expect, especially in the first few months. Even the healthcare professionals were not sure what they are dealing with because it is something they had never encountered before. Over the period of time, as we've had more experience, things are definitely much better compared to, say, March, April, May time where that was we are still learning about this disease. So, as I said earlier, this is the worst pandemic we've had over the last 100 years. And the last pandemic was in 1919. That was a Spanish flu pandemic. It was a really bad time. The world had just recovered from the First World War. Millions of people were dead. And then came the Spanish pandemic, once again, which killed about 150 or 200 million people at the time. A quick review of the facts of COVID. As I said, there's so much information about COVID. Probably you guys know more than me. There is so much going on in the news. There's so much going on in the social media, WhatsApp. So there is a lot of information. But unfortunately, not everything is the true information. There's a lot of misinformation being communicated unknowingly or unwillingly. It was first detected in Wuhan, in China, in November 2019. The World Health Organization declared it as a pandemic. Pandemic means where it affects a large group of people, particularly affecting countries, and then it spreads very quickly. So, a significant portion of the population of the world is being affected. So, this was declared as a pandemic in March 2020. This was a coronavirus. We know about coronavirus for a long time. It causes cold, cough, and then mild symptoms. However, this was a new virus. People did not know about this virus. That's why they called it the novel coronavirus. Uh, what was significant was it was more contagious than the normal coronavirus, and it was deadly. So it started affecting people. There are lots of people who died, especially if you see the first few videos of China, where it was not understood initially. Lots of people just dropped dead on the streets as well. Uh, it is somehow more serious in the elderly and people with pre-existing conditions like diabetes, heart disease. So these people are at more risk. Okay. A few symptoms of COVID again. Fever is the most common symptom. Dry cough, fatigue, sore throat, mucus production, breathlessness. So there are lots of symptoms. I won't go into all the details. Don't want you to make a medical talk. However, there was something new about this infection. So there was a new loss of taste or smell, particularly smell. Initially, it did not occur to medical experts that this was a new symptom. However, over the first few months, they quickly realized that this was a particularly strong symptom and was very specific to COVID. There are lots of instances where patients had very small and a bit of runny nose, or just feeling a little bit of tiredness or fever for less than a day, and then they lost the smell for a few days, and everything. There was all the tests were negative. The COVID was not tested at all. Therefore, people did not assume that they should go and test it. However, research has shown that these could be very mild cases of COVID, which has been successfully taken care of the body by the immunity itself. So, what was suggested? Uh, all the governments had and the medical community had to act. They could just not sit by idly and then let the whole thing unravel for itself. That was definitely not acceptable. So they devised a small formula called the SMS, which has been very popular. People know about it. S stands for sanitizer. However, I would suggest soap and water. If you can wash your hands with soap and water, that is definitely more effective. Obviously, it's not possible all the times. You may be out shopping. Then you can use a sanitizer. Wearing face masks. So This is to protect yourself and others. And once again, maintain social distance. They recommended a distance of about 6 feet. So this is all well known, and people are following to a significantly large extent. Nowadays, we don't see many people uh, going out without face masks. Okay. However, loss of freedom was not very popular. What is right is not always popular, and what is popular is not always right. This was said by none other than Albert Einstein. So there were a lot of grievance from the people that their freedom has been taken about, and there were also lots of questions by the younger people who were saying, "Fine, we are not affected. We're going to, even if we get the infection, we are going to get better from it. Why should we worry about it?" So there were two things that we had to do as medical fraternity to advise the governments. First thing is to protect yourself. So protect yourself from getting sick. So what they suggested was avoid unprotected contact with sick people. So if someone is not well, if they are sneezing, if they are coughing, do not go near them. Avoid spitting in public. And once again, most people have a habit of touching their nose, face, eyes. That becomes a habit subconsciously. Therefore, we had to advise people not to do this because that is how infections spread, especially with these respiratory droplet infections. And once again, try and limit contact with farm animals or even wild animals. Recently, they have found out that a zoo in Spain has had 4 cases of coronavirus in lions. What they suspect is that a zoo handler who was unknowingly infected with coronavirus may have given it to lions. There is also a horrible story in Netherlands where millions of minks, which they are reared for fur, were killed because they got coronavirus, and they were transmitting within themselves, and there was also a new mutation. Therefore, it is quite significant that we avoid farm animals or wild animals. In fact, we should remember that that is how coronavirus started. Coronavirus been there for many years, probably even a millennia. What they assume is that the reservoir was bats, so wild bats, and this started all from a wet market in Wuhan, where the coronavirus may have passed from the bats to the handler who was selling these wild bats. So that is how the theory goes as the first human occurrence of coronavirus. The second mantra is to protect others. So if you are sick, so avoid contact with other family members, friends, or stop going out. Do not socialize. Avoid spitting in public. If you do have a fever, cough, or breathing difficulty, all the symptoms I mentioned earlier, seek medical attention early. Do not delay. As things get delayed, your chances of getting better also gets diminished. The the other thing I want to emphasize is that there's a lot of research. For example, if you have a bigger room, for example, unfortunately you are affected with coronavirus, then if you are relatively stable, the government will ask you to quarantine at home. There is a lot of research to say that if you are isolated, if you are in a single room and away from the family, even if you are living in the same house, the risk of you transmitting the infection to your family members is really small. So, therefore, make sure that you stay away when you are sick. This may not be possible in all the cases because many people homes are not big enough. They may not have an individual room. However, if you do maintain distance, there are cases where we have seen one or two one or two people being affected in the family. However, the rest of the family becomes negative. So do take these advice seriously. So moving on to the COVID and the heart effects, the according to the World Heart Foundation, this is a perfect storm for the heart, and we see this day in and day out, because heart disease itself is the major killer all over the world. However, according to recent data in US, this has been outstripped by COVID. So COVID has become the top killer for 19 for 2020. So, what are the risks? So, if we look at the traditional risk. Older age group seems to be the one who have a much higher risk compared to the younger age group. This is common in many cases. If you have other coexisting problems, like if you already had a heart attack, or if you have heart failure, other heart problems, lung problems, kidney issues, or uncontrolled diabetes, that puts you at much higher risk of fighting the infection. If there is systemic inflammation, especially with arthritis, uncontrolled arthritis, where there is very systemic inflammation, that itself is once again a significant risk factor. If there is a coagulation abnormalities, what do I mean by that? If we have blood clots, so if you have a tendency to form clots, that puts you at much higher risk. And if you have multiple problems, you have more than one of these problems combined together, that gives you a much higher risk of getting COVID and also less risk of getting recovery. And once again, if you are mobile, for example, if someone is bedbound, they are not able to mobilize much. Their body function and immunity is low. That put them at risk as well. There is one slide regarding the impact of COVID on age. So this has been well proven on many studies. They took 18 to 29-year-olds as the comparison group, and then they compared it to the rest of the age groups. So as you can see here, the age group with the highest age group, 85 plus years, it's the 13 times higher risk of getting hospitalized and 630 times of dying from the infection. That's a staggering statistics. If you are 75 to 84, it's about 8 times higher. uh, Once again, death rate is about 220 times higher. So, what does this tell us? Age is something that we cannot change, I'm afraid. So, elderly people need to be more careful. Okay, though they need to take more care. Even if they do have family members who are going out, who are socializing, try and avoid very close contact with people who are moving in and out regularly. So let's look at some specific conditions where coronavirus may play an important role. For example, hypertension. If someone has got high blood pressure, that doesn't naturally put them at a risk of COVID infection or not recovering from it. What is significant is patients whose blood pressure are not controlled very well. So that makes a difference. If someone's blood pressure is very well controlled, they are at normal risk as everyone else, so they don't need to worry about it. Similarly, with diabetes, all diabetics are not equally at risk. Diabetes, we know very well that it reduces the ability of the body to fight infections. That's the reason any small infections, you might have heard the doctor saying, take it seriously, give antibiotics, make sure that the wound heals very well, otherwise it's going to get worse. That is very true because the fighting ability of the infections is generally low in diabetic patients. However, as I said, not all diabetics need to worry. If your diabetes is not controlled, that is when you need to worry because that impairs your immunity and that impairs your ability to fight infection. Obesity, once again, there are different classes of obesity. Just mildly obese, the risk is much lower. However, if you're morbidly obese, what we call a BMI of more than 40, that significantly puts your risk. Once again, the we know that obese people have a lower immunity and they are more susceptible to infections and to fight off infections. So that increases. So if you are obese, work on it. Make sure you lose weight. You have a healthy lifestyle. If someone has already had heart disease, once again, there are lots of my patients who had COVID and have recovered really well with heart problems. So it doesn't matter if you have had problem in the past, it's about ongoing problems. If you have an active heart problem that is still not very well under control, that increases your risk again. So similar to heart failure, where the heart doesn't pump very well, there is fluid overload, your breathing becomes impaired. That is when your risk also goes up. So this is once again a brief chart. We'll look into it into a bit more detail. So some of the conditions that we need to know about regarding specific to the heart, how the COVID might affect people. So there are few conditions called as myocarditis and pericarditis. What does this mean? This is inflammation of the heart muscle, that is myocarditis, where there is general inflammation, the immunity is a little bit low, and then there is pain across the chest. It can be very similar. It can be very difficult to differentiate this pain from heart attack. Therefore, you need to consult a cardiologist. Let them make the diagnosis, and then it can be easily treated. Usually, it is not as serious as the other heart conditions, and this is the most common manifestation of COVID we have seen. The first presentation in many COVID patients, I would say, is they come with chest pain, which doesn't fit with a heart attack. It's just non-specific and around the heart. And lots of studies as well as MRI scans have shown there's a lot of inflammation, edema around the heart muscle. So this is an effect of COVID. This is a direct effect that we have seen, and usually these patients recover very well. The next condition that I want to talk about is heart attack. This is much more serious. I think we all know that heart attacks is one of the most serious conditions, and it's number one killer in the world. Unfortunately, India is becoming the heart attack capital of the world. It is already the diabetic capital of the world. It is already the hypertension capital of the world. We have the dubious uh, the distinction of being that on top of the world map with all these problems. So a lot needs to be addressed, and a lot of effort from not only from the medical fraternity but also from governmental agencies as well as non-governmental agencies need to go into so that there is more awareness about the problems as well as getting timely management. So, what we have seen, unfortunately, is patients who are known to have heart problems or they suspect heart problems, but still very reluctant to come to hospital because of getting COVID. So, this unfortunately has led to many deaths. What worldwide they have done studies, and what they found is, especially at the peak time of COVID, patients have died at home with heart attacks without getting medical attention because they were so afraid of getting COVID. What they don't realize is more than 90% of patients who get COVID recover significantly well without any long term effects. Therefore, be cautious but not be very afraid. The most important thing is you get your treatment for other major problems like heart problems, heart attacks. So do not ignore that. So as I mentioned earlier, the myocardial infarction, heart attack can be fatal if not properly diagnosed and treated. Once again, I want to emphasize again and again that this is a timely treatment. Time is muscle. That is a very famous quote that we say in cardiology. What do I mean by that? Muscle is the cardiac muscle. So if someone is having a heart attack, if it is usually caused by a blood clot in the blood vessel that supply the heart. If we don't open that blood vessel, either by medications or angioplasty, then there will be no blood supply, and that part of the heart muscle will be dead forever. Once it is dead, it cannot be revived. So it is so important. That is what leads to heart failure. So I would urge again all viewers as well as other people to be aware of the problem and get medical attention. If this is not a heart attack, that's perfectly fine. You just get tested and then go home. If it is a heart attack, it can be managed properly, and your chances of recovery and a successful, good life after that is significant. There is another issue that we need to know about COVID, what we call as thromboembolism. Thromboembolism is nothing but blood clots which are formed in various parts of the body, and they go to places where they should not go. For example, if there is a clot in the leg, because we are not very mobile, which is the case these days, because we are sitting in front of the computer, people are working from home, they are not allowed to go out, so their activity level has significantly gone down, which means that people are just sitting on the couch for a long time. That causes clots in the legs, and then those clots can go up to the lungs, and then cause a clot in the lung. Also, there is a hole in the heart, which many people have. They don't realize that it's a very common thing. The clot from that can go into the brain, causing a stroke. What is particularly true about COVID and the clots is that in the initial days there was not a significant knowledge about blood clots. there were lots of patients who were dying. What we knew was that the lungs were the cause of death in most of these patients. So there was lung failure. The lungs are like a sponge. They get the deoxygenated blood and then give oxygen. So the exchange happens there, and then there's purification, and that's how the process goes on. However, there were lots of cases where the lungs were treated very effectively with antibiotics and other supportive measures, even with ventilation, but the patients were not recovering. Fur- Further, they got to know that this was not due to only lung infection. So there were multiple clots which are forming in the lungs, which led to death. So that was the time when they started getting to know, okay, there's a second mechanism that's causing deaths. So we are targeting only the lungs. As I said, this was all completely new to medical science, and no one knew about this disease before. So once they learned that blood clots are significant and they were the cause of death, people started using blood thinners, and that changed the scenario significantly. So patients who were started on blood thinners much more earlier had a significant recovery, and then they did really well. The next condition that we need to know about is palpitations. So this is what we call as arrhythmias. Arrhythmias are nothing but not normal rhythms. So there is a pattern to the heartbeat. If it is out of sync, we call it as arrhythmia. So it commonly manifests as palpitations. So you might feel the heart going a little bit faster, sometimes a little bit irregular. If it's for more than a few minutes, definitely it is not normal. That needs to be investigated. They can present with syncope, where patients they just collapse without any warning, or they can feel like a simple faint, where they understand that they're falling, but they still faint because they cannot prevent it, or just dizziness, where this everything starts spinning around, and then you don't feel very well. All of these are significant symptoms, and then they need evaluation by cardiologist if there is a cardiologist nearby. These things can be potentially serious if not detected or treated. So once again, the reason I'm putting all these medical conditions is not to confuse the general public or the listeners. It's so that everyone is aware of these common symptoms, so that they can seek medical attention and get treated properly. So the next topic that we need to be aware is heart failure and cardiomyopathy. So heart failure itself is not new, as I told you earlier. The heart failure, there are two reasons for heart failure. One, there's a heart attack. The heart muscle is dead. It doesn't work very well. That is why the heart doesn't pump very well. The second entity is something different, what we call a dilated cardiomyopathy, where the muscle itself is weak for no particular reason. Blood supply is good, it's not the blood supply, it's just the muscle that doesn't work. The treatment is very much, uh, but what we need to know is breathlessness is a very common symptom, especially on exertion. If you're trying to do something, if you're not able to walk for a few steps, when you're getting breathless when you're lying down, the legs start to swell up. There is swelling in the abdomen or the tummy. You feel very hungry. Without eating, you feel very full. You just don't have any appetite. Although you're not eating, you're gaining weight. That's because of fluid accumulation. So these are the signs you need to be aware of and seek attention. Particularly about COVID is that either patients who can present with overt heart failure, like all the signs I've told you, or very subtle signs. Patients may not have any of this, or very minimal. For example, they may have occasional signs of breathlessness. If they're okay going up to the first floor by climbing the stairs, but by the end of it, they're really breathing and panting. They take more than normal to settle down. There is also a new entity that we are seeing with these patients, especially COVID patients. Many asymptomatic patients, patients who never had significant symptoms or very minimal symptoms, they had a little bit of cold, cough, got better, and on routine examination, after doing an echocardiogram, a scanning of the heart, we find that the heart pumping function has reduced. This is very, very new to medical science, and we don't understand completely why this happens. You remember I told you earlier there's a lot of inflammation. That is the most common cardiac problem that we see with COVID patients. But we are also seeing that is the acute phase, that is that immediate phase. After that, there is a reduced pumping effect on the heart. Whether this is temporary or permanent at this moment, it is not clear. That is one of the other reasons why all these patients should be seen by cardiologists so that they can be followed up and see what happens. I am sure over the next few months, we'll have more data, we'll have more information of how to treat these patients. There are many times that we need to start treatment much more earlier rather than wait, because there will be some patients who are at risk, who already have heart problems or who have other medical problems, that we need to be more proactive and start treatment early rather than wait until they become sick. So that is one of the reasons why you should go to the doctor and then get an ECG and an echocardiogram. For patients who have survived the COVID, who have got better, I sincerely suggest that ECG and an echo is a must in the next 1 month after you have recovered, to see how your heart pumping is. A few tips for a healthy heart. I think you all know about these general tips, but I'm just going to put up a few slides so that we can skim through these. Exercise regularly. This is something that we have been telling for ages. However, there are lots of issues with exercise. I'm not suggesting anyone, everyone to take up weightlifting. That's just only a picture there. Any form of exercise. Walking is an excellent exercise. However, due to restrictions from COVID, people had their own lifestyle. So many of them would get up in the morning, go for a walk, come back, then go about their normal work. Some of them would go in the afternoon, some of them in the evening. All this has been disrupted. So you have to find a way out. So just saying, okay, fine, I cannot go out, I cannot do anything is not an excuse. There'll always be a terrace for everyone, so they can do walking on the terrace. There are people where even that is not accessible. So I would suggest even a small 10 by 10 room, pace in the room for 30 to 40 times. That itself will give you good exercise. Once again, you can do lots of stretching exercises. You're sitting, so you don't need any space for that. Do some exercise. If you are not exercising, if you are just sitting on the television or in front of the computer for long hours, as I told earlier, you are at risk of forming clots. So lack of exercise, that itself is one problem. Sitting idle and then doing nothing will increase your risk of clots. Also, it has been proven beyond doubt that if you are exercising, if you are active, there are lots of good hormones released, and your chances of getting depression are much lower. Patients who do not exercise have a much higher risk of depression compared to patients who exercise. Eating healthy is once again a emotive topic. The general advice is that have plenty of vegetables and fruits. So I don't need to go into much detail. All of all of this is available. The information is available freely. Lots of people who are dietitians, and then they give you advice. So in general, what I would suggest is have plenty of fruits and vegetables. Eat protein foods and less of sugar. Previously, it was thought fat was the culprit. Fat is still the culprit, but once again, it is not as bad as sugar. So, sugar is the worst culprit. Sugar, I mean glucose, anything that is direct sugar is bad. Sugar in all the bakery products and all the foods, processed foods, need to be to increase the shelf life. Either they have to add sugar or salt. So that increases your risk anyway, and especially if you're heart patients, you should not be eating much sugar or uh, salt as well. And once again, whenever there is a possibility, choose whole grain foods. Obviously, there are lots of diet revolution happening these days, which you're all well aware of, so I won't go into much detail about that. The other very important thing which is often overlooked is reducing stress. There are some studies which say stress is as bad as smoking. So if you think, okay, I'm not smoking, my risk is very low, but you're having an extremely high stress, that is as good as smoking. when I talk to patients, they tell me that, okay, I'm going through a lot, there are lots of difficulties with one thing or the other. The common advice I give them is, fine, you cannot change the situation. Worrying itself will not change your situation. So if you have to deal with it, deal with the situation, do whatever is necessary. I'm not saying do not do this or that. It is entirely up to you how you deal with it. But if you take that on extra stress, that itself will not cure your problems. Once again, stress releases lots of bad hormones where that causes coronary spasm of the blood vessels that supply the heart, and lots of heart attacks happen with that. There are also these hormones cause angina, chest pain, as a very common symptom. So whenever the patients get stressed, they get chest pain. So that is a very typical symptom. We see this very commonly in women in the middle age group, about 50 to 60 years, 40 to 60 years of age, where they are under significant stress for whatever reason. And when we do the angiograms are completely normal. So there is no mechanical flow issue. So there is no blockage as such, but their symptoms are real. So every time they have a stress, the artery is going to spasm, creating a temporary block. So when the stress goes away, the artery relaxes on its own. We do give tablets to help with this, but once again, the only solution would be to avoid stress. Uh, Also, the more stressed you are, the more depressed you become, and your ability to fight infection. What they've also found is that if your stress levels are high, your immunity levels go down. So, once your immunity is down, your ability to fight infections also goes down. They have done some studies over the last 8 months about COVID. They found that up to 40 to 50% of the population in general, the stress levels have significantly gone up, and about 10% of the population is depressed. So those numbers are really worrying. And when I speak to my colleagues who are in psychiatry, they are seeing a significant number of patients who would normally be very happy and going about their normal work. Uh, it has become very widespread these days. And this is a no-brainer. Stop smoking, alcohol, and no recreational drugs. Uh, Many people ask me about alcohol. Is alcohol safe? Is alcohol good? There are some studies. Well, there are many studies which have been done regarding alcohol. What the only evidence for alcohol having any beneficial effect is red wine, that too about in very small quantities. They say about 10 to 20 ml of red wine, which is almost like a tonic. So if you are able to stick to that, yes, there is small benefit. Otherwise, no other alcohol has shown any benefit. In fact, there are lots of uh, deleterious effects of alcohol on the body. So stop drinking if you are a drinker. Uh, I think we are nearly going to the last few slides. Do not stop your medications without consulting your cardiologist. Have at least 30 days supply of tablets. This is not much significant these days, but in the peak of the pandemic where the restriction was significant, you are not able to go out, just to make sure that you don't run out of tablets, keep at least 30 days of supply. Once again, do not delay seeking medical help because of the fear of COVID. As I said, most patients who develop COVID recover very well, more than 90%. In fact, your heart condition might be more serious than contracting COVID. Also, major hospitals these days, all hospitals probably I would say, are well equipped to deal with COVID because of the knowledge that we have compared to the initial days. Okay. Also, make sure you have severe sorry you have contact number for your cardiologist and you're aware of what to do in an emergency, where to go. So have these things handy. Also, discuss this among your family members. For example, if one person becomes sick, the other people should know what to do. Most doctors these days are doing video consultation, and please make use of this facility when physical visits are not possible. There are lots of my patients who I know very well, and I've been seeing them over the pandemic as well through video consultation without any requirement for physical visits. Obviously, there will be some patients who are sick and they need to come to hospital and then see them. Uh, Once again, there is no distance limitation at all because I'm seeing patients from Bangladesh, I'm seeing patients in the Northeast, Assam, West Bengal, Madhya Pradesh, Bihar, all over the place. So they are able to make use of this. And as I said, most of my colleagues, most of the doctors are doing video consultation. So please make use of this technology. It is very, very simple these days. And the other thing that you should have is a list of COVID care providers, either government hospitals or private hospitals that is near to you that you have trust in. So if there is any possibility that you may have COVID, go and get it tested there. So the other question that frequently comes up is, what about visiting family and friends? So the official advice is consider the level of risk. In general, the more people you interact with, so if you're dealing with lots of people, that increases your risk. The more closely you interact with them, and the longer that interaction, the higher your risk of getting and spreading infection. So, as I said, always two mantras. One is that protect yourself, protect others. Just a few words about long COVID. So, for patients who have already recovered from COVID, there is a new entity called long COVID. There's no official medical definition of long COVID, but the most common fatigue they have described is significant fatigue. That is the most common feature. You might just feel that you're not totally recovered, but if you do all the blood tests, the tests are all negative. So this syndrome is not necessarily new to science because we have seen it in other viral infections, especially chikungunya, where patients will have significant arthritis even after many days, in fact, up to a couple of years. And it is estimated that about 10 to 20% of patients may experience long COVID symptoms to varying degrees. I will not go through the full list of symptoms, but as I said, chest pain is also one of these symptoms. And once again, as mentioned earlier, patients who have recovered from COVID, please see a cardiologist to get an ECG and an echocardiogram done to see everything is okay. Okay, fine. I've given so much information. I'm afraid there's nothing very positive about it. I've told you what are the potential problems that might happen. So the question is it all doom and gloom? Hopefully not. The future looks brighter. As I said, since the pandemic, the medical fraternity is much more knowledgeable compared to the first few days. There are much more treatments available these days. As I said, there are antiviral injections that is very commonly given. I'm sure you have all heard of remdesivir. Steroids are being used routinely. That itself has made a significant difference. Patients are recovering very well. The recovery rate in India is more than 90%. That is an excellent sign. In general, patients who have mild COVID or patients who just want to have better immunity, it is worth taking some vitamin tablets. So vitamin D, it's been recommended. Vitamin C is recommended. Also zinc. So these are three things that is routinely recommended to boost your immunity. So a 1 month course of these tablets will do you good. So this is a new kid on the block. I'm sure you've all seen the news. There's been a lot going on about vaccines. There are about 10 to 15 vaccines being developed. In fact, many countries have already started vaccination. I just read on the news this morning that America will be doing mass vaccination next week. So this is already on the cards. This was the first lady in the United Kingdom. She was a 91-year-old grandmother who became the first person to receive the uh, Pfizer vaccine. So you will see more vaccines being developed, and hopefully, uh, I believe, India might get the vaccine in the next 4 weeks. Although not everyone will get it. So the question is, when will I get it as a general public? The first priority goes to healthcare workers because they are the ones who are on the front line. Unfortunately, more than 660 doctors have died in the line of duty. I'm not even mentioning about the number of nurses because that's a much higher figure. Also, other personnel who have contracted, police. So lots of people have died. So they will get the vaccine first. As I said, frontline workers like police, defense personnel, disaster management workers, municipal councils, municipal workers who take away all the waste, those will be the next people to get it. After that, people who are more than 50 years of age, they will get it. Next would be people less than 50 years of age, but with other heart conditions, lung conditions. So after that, if you are in one of those low risk categories, you might get it later on. So questions about, okay, once you got the vaccine, what next? Will I get back to being normal? That is pre-March 2020, how things were after vaccination immediately? The answer is no. It will definitely take its time. Remember, we are a nation of 1.2 billion. To vaccinate everyone, we might take at least 6 months to 2 years. So until that time, you are not totally safe. However, the restrictions might come down once a significant portion of the population has been given the vaccine, uh, but it will take some time. So, can I stop wearing the mask, using sanitizer, social distancing? The answer is no. You still have to take your precautions because that is the only thing that is shown to be shown to have a significantly positive effect in stopping the virus spreading. As I mentioned earlier, mass level immunization can take up to 2 years to give a herd immunity. And once again, we should remember that not all may want to get immunized. This anti vaccine movement is particularly strong in America and some European countries where there is a lot of skepticism about vaccines, and not only COVID vaccine, but vaccines in general. And those patients will never get immunized. Those general public will never get immunized. We should also not forget that reinfection with a mutated virus remains a possibility. For example, the vaccine is for this current mutation. If the virus starts mutating and becomes changes its nature, then the infection with that remains a significant possibility. So finally, I would say do not ignore SMS. So hand washing with soap and water, or use of sanitizer, wearing a mask, and social distancing. Protect yourself and others. Be cautious but not overtly fearful or distressed. Most patients recover very well from COVID 19. As I said, our recovery rates are very good. However, prevention is better because some people do become seriously ill or even die. Do not ignore symptoms of ill health. Seek prompt advice from the medical team. Once again, as I told you, the other medical conditions are probably much more serious and needs to be treated. So don't stay at home thinking that you might contract COVID. There's definitely hope in the near future. And very importantly, believe information only from genuine sources and not WhatsApp messages, even if it's originating from a known person or source, however well intended. So with that, I'll uh, stop my talk, and thank you for listening.
Thank you so much, Dr. Praveen Sadarmin. It was a wonderful presentation, and we must appreciate you have covered a lot of subjects and a lot of queries already in your presentation by people. It's already 10:30, but still we would like to take one question that uh, people who are hospitalized due to COVID-19 are suffering with heart diseases, right? Cardiovascular issues. But is it a possibility that people who have not developed symptoms and are simply isolated at home may also develop cardiovascular issues due to COVID-19?
Correct. I think I already put that up in my slide. That's when I said
Yeah.
patients who have recovered from COVID, I urge all of them to go and have a basic ECG and an echocardiogram. So that will tell us how their heart condition. There are lots of patients who are coming to who had absolutely no cardiac symptoms. So they had a bit of cold, cough, and all those things. They got recovered well. However, the heart function has gone down. At this stage, we do not know whether this is permanent or temporary. I hope it is temporary, and I start them on tablets to support the heartbeat more. What I'm hoping is over the next few months, the heart recovers with all this, either by on its own or with help of the medicines they're given, and then they all get back to normal. At this moment, we are not 100% sure. That is the reason I urge everyone, especially who have recovered from COVID, to get an ECG and an echocardiogram.
Right. Thank you. Thank you so much. One more question I'd like to ask you that, as a cardiologist, what are the trends among the patients whom you have treated probably? Have they come back later with problems related to heart to you?
The one thing that we are seeing very commonly is, as I told you, is the inflammation of the heart. They come with chest pain, very typical. The chest pain is not necessarily of heart attacks. So that is the inflammation heart muscle. That is in the acute phase where there is infection. We treat that with simple painkillers, and some of them may do require steroids, but they do recover very well. What I'm also
Right.
seeing is patients who are coming back with heart failure later on. So that's a very small proportion at this moment, but it's too early because it takes some time for some of these patients to develop heart problems, and maybe even 3 to 6 months later, I might see them. At this moment, that's the reason I'm asking everyone to be open to go and see their cardiologist if there is any problem. So don't delay because time is very important. So if you delay and there is already heart damage, very little can be done. If the heart, as I told you on the echo scan, the heart is not functioning optimally, then we can start tablets to help the heart and then make a recovery faster.
Yes. Uh, Someone has sent this message to us on WhatsApp that due to nature of my field job, I have to wear my mask entire day. Will it affect my heart?
Depending on what, because there are different types of masks. The what medical lesson, what I wear in hospital is what we call an N95 mask, which is much a
Yes.
very tight fitting mask onto the face and the chin. They have done studies and that has not shown any significant problems leading to, because one problem they were expecting that we are taking too much of because we're breathing in and all the carbon dioxide is going back. That is not the case. So there's, if you are using the normal mask, for example, a surgical mask or even a cloth mask, that risk is negligible. Absolutely, you don't need to worry. I'm talking about in hospital very, very, very tight masks to protect ourselves from COVID when we are dealing with COVID patients. Even that mask, there has been no effect. So the answer is no.
Right. Thank you. Thank you. Thank you so much, Dr. Praveen Sadarmin. We thank you so much on behalf of elets Technomedia and Viatris entire Narayana Health team for supporting this initiative. I would request we had about 1500 to 1700 people watching us live. I'll request them, if you have any question, please send us an email and we will surely get the answer from Dr. Sadarmin for your questions. You may, as you can also watch the video, if those who have missed the live video can of course visit our website again and watch the entire presentation, entire talk on our website. The video will be uploaded within 12 hours on our website. You can again visit our website and watch the complete video. So with this, we would formally like to close this session, Dr. Praveen, and we would like to thank you so much for your support and your guidance to make this initiative a successful
Thank,
one.
thank you very much. It was a pleasure to me as well.
Thank you, sir.